Good morning, you guys. Welcome to another day in my life together. My name is Nayiri if you're new here. I'm a psychiatry resident doctor in LA and I share my life is like. And let's just quickly, now that I said good morning to you guys, go back to my actual morning and we'll start the day. Workout is done. Feels super good. I'm not gonna lie, it was really hard to get out of bed this morning. Some days are just harder than others. Today was one of those days, but we had a pretty good workout and it always makes me feel really good, especially when I'm going into a 24-hour shift like I am for today, because tomorrow I probably won't work out because after working for 24 hours my body's destroyed, so I like to at least do it before. So feeling good. I have such a long day today. We have so much going on, but first I'm gonna make sure that I get breakfast and coffee going so that I'm not late, but we're gonna need some deep breathing and patience to get through today for sure. Coffee time. I made the best breakfast. I think I shared it in my chair broken? Why is it so wobbly? I shared it in my most recent vlog, but it's this really good toast. It's multi-grain toast from Erewhon, but I originally wanted sourdough. They were sold out. I got this delicious avocado, a jammy 6-minute egg, and then a cup of egg whites for extra protein. So I'm gonna devour this because I am starving. But I wanted to use this opportunity to talk to you guys about the sponsor of this portion of today's video. You guys know, being a resident doctor, my days are packed with back-to-back rounds, charts, notes, patient care. Sometimes, like days like today, I actually even work for 24 hours at a time. So I literally talked about it this morning. What is more important than taking care of other people is taking care of yourself first. That's a huge reason why I work out in the morning before even 24-hour shifts, because I need at least a little bit time to myself to pour into myself so I can pour into other people. And that's where the sponsor of this portion of today's video, ZocDoc, comes in. If you guys have been here before, you know I've talked about ZocDoc before. Whether it's for a quick checkup or a problem that kind of just started, or just a wellness check, ZocDoc makes it so easy. ZocDoc is a completely free online website that makes finding and booking healthcare appointments simple and stress-free. You can search for providers based on your needs, whether that's specialty, location, even insurance coverage. The best part for me is that you can skip the long waits by offering appointments as soon as the same day or even the next day in many cases. You also don't really need to talk to anyone. You could just book with a few clicks. It's like having a personal assistant for your health. The cherry on top is you can see real patient reviews. I know how overwhelming it can be to navigate health concerns, especially with the internet being filled with conflicting advice. For someone with a schedule like mine, ZocDoc is a game changer. Whether you're a doctor, a student, or just someone who's juggling life's chaos, ZocDoc takes the stress out of finding great care. Trust me, your health deserves this kind of convenience. If there's one thing I can encourage you guys to do, it's to prioritize your health this year. It's a free platform, so I encourage you to check out how easy they make it for you to take care of your health. The link is in the description box below. Also visit ZocDoc.com/DrCat. Now I need to devour. That crunch. Morning. I have a new phone holder in my car. My husband ordered it for me. It is amazing. Oh my gosh, I had previously ordered maybe 2 other ones and they all were terrible, but this one, he did some research and I'm so grateful because I love it and I record unfortunately everywhere. So good morning, it's traffic, we're going to work. I wanted to kind of give a rundown of the day. So obviously I'm on a 24-hour shift, so I will be here from 8 a.m. today to 8 a.m. tomorrow. But I'm in the inpatient unit. Today is going to be busy for multiple reasons. One, I have another court hearing today. So yesterday I had a court hearing. That one was different because it was the patient basically petitioning to the court saying they don't think they need to be hospitalized and that they should be discharged. Today's is me petitioning the court saying my patient has been refusing medications for X number of days. I think they need medications in order to get better so that they don't, they get discharged, because you can't safely discharge a patient, of course, if their symptoms are not improving. So essentially you petition, as the physician, you petition the court saying the patient should be forced to take medication. So there are 2 different types of court hearings, but essentially a lot of the presentations or a lot of the questions you answer are very similar, of a patient's diagnosis, what medications you gave, why, what symptoms are you seeing, how do you anticipate this helping, what's the plan, etc. So that is happening today. I also have interviews. So we're still interviewing for residency. So today is my day of interviewing. So that takes a lot of emotional energy, social energy, because you have to talk for hours. So there's that. And then we have a regular work day also on top of that. So seeing patients, doing notes, new admits, etc. And then what else? Oh my gosh, why is it so trafficy? And then I'm stuck there for 24 hours. So there's lots of other things that are going to happen. I'm going to get handoff from my co-residents and we'll see how the day goes. We're going to have our weekly debrief meeting where it's basically a meeting we have with the residency program, the residents, where we talk about changes, updates, questions, concerns, things like that. So that is what's going to happen. The first thing I'm going to do is go and see my patients real quick, go to treatment team, go to this court hearing, which the annoying thing about these court hearings is they take forever. Not take forever for my case, take forever because you have to wait because you don't know where you are in line for these court cases. So we'll see how long it takes. Yesterday it took 3 hours for it to be my turn. Perfect, because I'm just sitting there and I'm not busy. I have nothing else to do, right? Sarcastic. Cool. I'll see you guys later. Just finished my court hearing, which was actually so efficient. Yesterday it took 3 hours, I told you guys. Today they called me saying we're free early. Do you want to start early? I was like, yes, absolutely. So now I'm going to interview for an hour and a half. Been a busy day. I did another court hearing today, like I mentioned. Did the interviews, saw my patients, did the notes. I just got some bubbly sparkling water and fruit. I'm gonna go up and work on some other things that I need to, but we have a lot of hours left of the day. Hi, it's 6:30. This is the part of my day where I start to go downhill and get so tired because this is when I'm showered, eating dinner, getting ready to go on the couch. But we're here until 8 a.m. tomorrow, so that's not happening. Everyone is gone. I don't know if I gave a little overview about why am I like this. Okay, I did my court hearing. I think I said this. I don't even remember what I told you guys because so much has happened today. How is it just one day? Did my court hearing, saw my patients, did the interviews for the applicants, did my notes, my co-residents signed out to me. Yeah, now essentially I see any emergency consults. I evaluate anyone that comes into the ED, and I handle any emergencies in the BHU. I'm gonna get my little bunk ready, and then I'm gonna talk to you guys because a couple of you had requested that I go through some stuff in my next video, so I'm gonna do it with you guys. I have food in my teeth. I have this little handy dandy kit where I have, some freshening up stuff, medicine, toothbrush, floss, skincare stuff, so that I can feel a little less gross, because I really want to jump in the shower right now. We don't have a shower, and I would not shower here. I want to shower in my house, but I'm gonna do some freshening up and then go on that little recliner. I'm gonna talk to you guys because you wanted me to, and then I'm watching Dynasty, so I'm gonna watch that and hopefully it stays quiet. Okay, so I was asked to go through patient cases or presentations because you guys are super interested in like psychiatric presentations. Obviously, I can't do that in real life because HIPAA and patient privacy. I'm literally using ChatGPT I said, can you give me an example of a psychiatric patient care, make it inpatient acute case. So none of this is real. ChatGPT gave me a random case. Nothing I say can be related to an actual patient because the computer made this patient case up. Okay, so we're gonna go through this case together. Patient is a 24-year-old female college student brought to the ED by police after exhibiting bizarre behavior on campus, shouting at strangers, claiming she was being monitored by hidden cameras, and attempting to climb a tree to escape surveillance. Past psych history, none documented, but family mentions she has become withdrawn and paranoid over the last few months. Family history of a dad with bipolar disorder, no medical issues. Substance use include cannabis use and no other drug use. So this is all the information you get. Appearance. So what we do next is always a mental status exam. That's essentially our physical exam. You go through a lot of things, including appearance, disheveled, wearing mismatched clothing, behavior, agitated, pacing, intermittently shouting. Mood is described as terrified. Affect is labile, shifting rapidly between fear and anger. The speech is pressured, tangential with frequent derailment. The thought process is disorganized. The thought content includes paranoid delusions, belief of being monitored, grandiose delusions, claims having special powers to detect surveillance equipment, no suicidal or homicidal ideations, but states she's on a mission to expose the truth. Perception, endorsing auditory hallucinations of voices commenting on her actions, and cognition is oriented to person but not place or time, or insight and judgment. So lots of things can be going on. What you need to do is talk to the patient and get more information from them with symptom wise. Second, talk to family or collateral. So anyone, family, friends who can give you more insight on the patient's behavior at home. When did these symptoms start? What was her childhood like? How is she socially? Does she have any friends? Does she have a job? Ask about psychosocial things like school, job. Have we been in any legal troubles? Drug use we kind of talked about. Medications, any medical problems. And then for young females, or really most females, I like to ask about menstruation, regular periods, mood symptoms during periods, things like that. So there could be a lot of things, right? You want to get labs, a CBC, a complete blood count, a basic metabolic panel, urinalysis, urine drug screen, of course, a pregnancy test, of course. What else? You can also do things like TSH, T4, B12, vitamin D. It's not gonna change your diagnosis per se, but they're important to know about. So a couple things happening. It could be first break psychosis of schizophrenia. It could be substance-induced psychosis. You have to rule that out with a drug screen, and even cannabis can induce psychotic symptoms in patients. Cannabis is not safe, okay? It can induce psychosis, it can induce mania. You can have bipolar disorder with psychotic features, or brief psychotic disorder. So, differential is pretty broad. What you do, okay, what else? Over the next 48 hours, agitation decreased. Patient is engaging minimally with staff. Eutox was negative. CT of the head showed no abnormalities. And she was started on Risperdal, which is antipsychotic medication, titrated as needed. And she seems like got better. So that is honestly pretty standard for the kind of cases that we see. This case was kind of unique in that it was a first break, meaning it was kind of the first time this fake patient, has experienced these psychotic symptoms. So it's really a unique time in the period of diagnosis because it's the first time they've ever experienced these symptoms. Yeah, I don't know if that is interesting, that's what you guys are looking for, but let me know what else you want to see in the videos, and I will do my best to try to incorporate it, but I'm gonna try to chill for a little bit because I know there's no way it's gonna stay quiet, so I'm gonna use my time wisely while I can. It's 9:40. I literally just put my head because I was so tired, but I got woken up to go see someone, so oh, my hair. Good morning. 7:45. I woke up, I saw my patients for the day. I'm doing the notes right now, which honestly I didn't have a terrible night, but I'm tired. So I'm gonna finish this quickly and head home and shower and chill. And I will see you guys in my next video. Thank you guys so much for watching. I hope this was interesting. Don't forget to take care of yourself. You matter just the way you are. And I'll see you guys really soon.